Hello, this is Galit Goldfarb and welcome to my video. Today I'm going to be talking about how to treat asthma with diet and supplements. Asthma is a chronic respiratory disorder associated with airway inflammation. Asthma is affected by environmental factors and genetic susceptibility that both play a role in asthma pathophysiology. Common symptoms of asthma include wheezing, coughing, shortness of breath, and chest pain or tightness. Also, healing from the common cold or flu will take longer for people with asthma. We know that allergens and pollution are common triggers for asthma, which can lead to an asthma attack. In an asthma attack, so to speak, the muscles around the bronchial tubes constrict and inflammation in the lining of the airways occurs, and the airways overproduce mucus, leading to difficulty in breathing. Now, dietary factors are not commonly associated as triggers or influencing factors in asthma. However, since dietary patterns modify systemic inflammation, having certain dietary patterns producing inflammatory effects and other dietary habits having anti-inflammatory properties, dietary habits do influence asthma pathophysiology and may trigger asthma attacks. Now, dietary habits have been shown to influence disease outcomes in asthmatics, such as lung function and the frequency of exacerbations and airway inflammation in people who suffer from asthma. Also, obese patients do not respond very well to inhaled corticosteroids, so dietary intervention could help solve many of these issues. In this video, I will dive into the dietary habits and supplements that may help relieve asthma symptoms and prevent asthma attacks. But before we talk about these, first let's go into the dietary habits which do increase asthma symptoms and increase the rates of attacks. Well, the dietary habits which have been shown to increase asthma symptoms include regular consumption of convenience foods, highly processed convenience foods, refined grains low in nutrients and fibers, processed and red meats, sweets, fried foods, and dairy products, and wine with sulfites. Now, the reason these dietary habits increase asthma symptoms is because these dietary habits are pro-inflammatory. These dietary habits are rich in saturated fatty acids, rich in sugar, and rich in total energy. And they lack in nutrients, which altogether lead to immune activation. Now, these foods are also rich in sulfites, which can exacerbate asthma symptoms in some patients. Now, even a single high-fat meal has been shown to negatively influence expiratory volume in adults with asthma. Also, a diet that is high in fats will negatively affect the gut microbiome composition, allowing growth of invasive bacteria, reducing the health-promoting bacteria, leading to more inflammation. So now that we talked about the dietary habits that increase asthma, let's talk about the dietary habits which have been shown to decrease asthma symptoms, these include regular consumption of fruits and vegetables, which are rich in vitamins and minerals and fiber, antioxidants, polyphenols, flavonoids, and carotenoids. Fruits of particular benefit that have been shown particularly to have benefit on asthmatics include apples and oranges. Also, whole grain cereals and potatoes rich in fiber are very important, as well as omega-3 and monounsaturated fatty acids found in seeds, walnuts, and also fish. But I personally don't recommend consuming lots of fish due to the high levels of toxins found in most fish that are sold today. Also, legumes of all sorts are a great source of plant-based proteins. And research shows that these dietary habits are especially beneficial for asthma because they are rich in antioxidants that decrease susceptibility to oxidative stress inside the body and are anti-inflammatory, rich in anti-inflammatory nutrients, which decrease C-reactive protein, which rises in the blood in response to inflammation and activates the complement system, which is a part of the innate immune system which promotes inflammation. Also, the fiber-rich foods on such a diet which include whole grains, legumes, fruits, and vegetables, and seeds, are fermented by the gut bacteria and produce short-chain fatty acids, which have immunomodulatory effects. These effects have been shown to reduce airway inflammation and protect against airway allergic responses. So if you suffer from asthma, as with any disease based on inflammation, you want to improve your diet based on the guidelines that I just mentioned. Also, there are certain supplements that have been shown to reduce asthma symptoms. However, I do recommend speaking to your doctor or dietitian that has all the information about your condition and medications before you take any singular mineral or any singular nutrient, and also any kind of food supplement. So let's get into the supplements that have been shown to reduce asthma symptoms, and these include number 1, choline. A study found in Free Radical Biology and Medicine showed that when choline is combined with selenium and vitamin C in a nasal spray, it helps cure allergic airway disease in mice. Now, though it has not been tested on humans, taking choline as a supplement or in a nasal spray could reduce the frequency and severity of asthma attacks. Second supplement is magnesium. Since asthma patients have been shown to have low levels of magnesium, taking magnesium either in the form of a spray to open bronchial tubes and allow increased airflow during an asthma attack is recommended according to a study from Drug Design, Development and Therapy. Magnesium is good during an asthma attack because it relaxes the airways. It inhibits muscle spasms and reduces inflammation by increasing nitric oxide production in the body. So taking oral magnesium supplements can also be of help. I recommend no more than 2 times a week as a preventative measure, but of course, please speak to your doctor who knows which other medications you are taking and whether everything goes along well together. The next supplement is pycnogenol, which is a herbal remedy extracted from the French pine tree. It has a very potent anti-inflammatory effect and could be a possible treatment for asthma, according to a study done in the Food and Chemical Toxicology Journal. The next supplement is Thymol. A study from the Journal of Phytotherapy shows that thyme extract can fight inflammation. The next supplement is black seed. A study from a journal showed that black seed extract could have anti-inflammatory benefits on the lungs. Also, vitamin D. Since people with severe asthma usually have low levels of vitamin D levels, try exposing your skin at least a few minutes a day to sunlight during the summer months to increase your vitamin D levels, or supplement regularly. I recommend that you read my article on which is the ultimate guide to vitamin D for all you need to know about this unique vitamin and how you should supplement the best way to do that. The next supplement is vitamin E. Vitamin E supplementation has been shown to have effects on lung function, especially on expiratory volume and vital capacity, which improves significantly after supplementation of 50 milligrams per day of vitamin E. But since this is a fat-soluble vitamin, it doesn't leave the body that easily. I do not recommend regular and constant supplementation. Supplementing about 2 to 3 times a week can help you, but please also check with your doctor. So I hope this video has helped and has provided you the important information on how to cope with your asthma. And I hope you liked the video. If you did, please give it a thumbs up. I hope it helped. And please also subscribe to my channel and ring the notifications button for notifications every time I upload a new video. Also, please visit my website, theguerrilladiet.com, for anything to help you improve your health and wellness following my research on the ideal diet for humans. So thank you very much for joining.